Okay, let's wait for some people to join. Okay, so let's begin. Today we are going to discuss about pharyngitis. Pharyngitis, it's very common. अगर हम बात करें तो sore throat, right? Sore throat कितना common है? गला खराब होना, हम सब ने कहीं ना कहीं देखा है गला खराब होना, sore throat. It's a very common thing, but today we will understand every aspect related to the sore throat and the pharyngitis. We have a case here, we will discuss it. But first of all, I want to tell you that pharyngitis, it's very common, but it can be related to the very complicated things also. So we will not take it very lightly. We will study in detail and we will look into the every aspect of it. Okay. And in the end, I'll tell you some bonus tips also related to the pharyngitis. So we shall begin now. We have a case here. Okay, let's begin with the case. A 30-year-old male, okay, comes to the hospital with a main complaint of sore throat, okay, and fever for the last 2 days. He reports when he reports pain when swallowing, but has no change in voice, drooling or neck stiffness. Okay, so यहाँ पे हमें क्या करना है? हमें सिम्टम्स पे ध्यान देना है. ओके, सोर थ्रोट है पिछले 2 दिन से, swallowing पे दर्द है, right? But no change in voice, no drooling or no neck stiffness. Okay, he has no recent history of cough, no recent history of cough, rash, nausea, vomiting, or diarrhea. Nothing like that. He denies recent travel and has received the full series of childhood immunizations. Okay, he has no medical conditions, takes no medication, and has no allergies. तो हमारे पास यहाँ केस क्या है? हमारे पास है कि एक बंदा है जो सोर थ्रोट के साथ आ रहा है, गला खराब है बेसिकली. ओके, सो पिछले 2 दिन से है. ही रिपोर्ट्स पेन व्हेन swallowing, उसके निगलते वक्त दर्द हो रही है और उसकी वॉइस में कोई चेंज नहीं है, कोई ड्रूलिंग नहीं है, कोई नेक स्टिफनेस नहीं है. और एग्जामिनेशन पे हमें पता चलता है कि ही हैज अ फीवर and heart rate of 80 beats per minute, blood pressure of 118 by 64 mmHg, and oxygen saturation of 99%. ठीक है. On room air, his posterior oropharynx shows erythema with tonsillar exudates. I'll come to these points. What does these points mean in the analysis part right here? Okay, for now, let's just read the question. Without ovular deviation or significant tonsillar swelling. His neck examination shows tenderness of the anterior lymph nodes. Okay, tenderness of lymph nodes is present. Chest and cardiovascular examination are normal. His abdomen is soft and non-tender with normal vowel sounds. and no hepatosplenomegaly. No hepatosplenomegaly. Okay. His skin is without rash. Okay. So, what do we need to do first? We need to do the ABC, right? We need to do the ABC, airway, breathing, circulation. What do I mean by ABC? We need to rule out the life-threatening complications here. But do we see any life-threatening complication in this case here? Our patient is coming with the fever and sore throat and pain with the swallowing, but no change in voice, no respiratory symptom, no cough, no drooling, neck stiffness. Just these lymph nodes are swollen and no hepatosplenomegaly. Like there are no symptoms which can relate to the life-threatening conditions. Respiratory symptoms are absent, and anything else which can be related, which can be dangerous, is absent here. So things to note: sore throat, okay, pain, swallowing, lymph node tender, right? What do we have? Fever, okay. But there are things which are not there. For example, cough is not there, drooling is not there, stridor is not there, okay. So what are these symptoms suggesting? Cough is not there, drooling is not there, stridor is not there. Stridor is not there, that means larynx is not involved, voice is not involved. Drooling is not there, that means epiglottis is not involved. Cough is not there, that means respiratory symptoms are absent. So what do we have? We have sore throat, pain, swelling, lymph node tender, and fever. Whenever there is lymphadenopathy, we can relate this to the bacterial infection, right? And sore throat is also now with the lymph node swelling with tender lymph nodes, it's related to the bacterial infection. And pain is also there due to inflammation. And we also have fever present. So ये किस चीज की तरफ हमें इशारा कर रहा है? Do we have any viral etiology here? No, because viral symptoms are absent. Absent, right? But bacterial symptoms present, right? A bacterial symptom present have viral symptoms absent. But pharyngitis, if you know, viral infections are the most common cause of the pharyngitis. But we don't have the viral symptom here. We have bacterial symptom. So what is the most common bacteria which can cause the pharyngitis? कौन सा बैक्टीरिया गला खराब कर सकता है? Most common. It is streptococcus, right? Group A. Streptococcus group A can cause pharyngitis most commonly if we talk about bacteria. There are other bacteria also which can cause pharyngitis, but let's now stay focused with the streptococcus. Okay, so here we have the diagnosis of bacterial pharyngitis. ठीक है. Now let us also study about some viruses. Which viruses can cause pharyngitis? Viruses are the most common causing agent factors. So there are viruses which are rhinovirus, influenza virus, for example, Epstein-Barr virus, for example, and recent coronavirus also. These are just the highlights. There are many more viruses which can cause the pharyngitis, but we cannot go into the depth here, right? And what are other bacteria which can cause pharyngitis? What are other bacteria which can cause pharyngitis? We have already mentioned the streptococcus group A streptococcus, and other are group C and G also. which are not very common but can cause. And Neisseria gonorrhea can also cause the pharyngitis, okay? But it is rare. Most common, we only see the streptococcus group A, right? Possible causes. Possible causes, we have already mentioned the viral etiology, viruses, bacteria, and the other infections. Viruses, bacteria, and other. अदर में क्या आ जाता है? अदर में आ जाता है एलर्जीज, फॉर एग्जांपल इरिटेंट्स एंड एसिड रिफ्लक्स. एसिड रिफ्लक्स कैन ऑल्सो कॉज फेरेंजाइटिस. फॉर एग्जांपल गर्ड, एसिड का रिफ्लक्स आ रहा है, एसिड ऊपर तक आ रहा है, गले तक आ रहा है. व्हाट इज इट डूइंग? It is hitting your pharynx and leading to the pharyngitis. So acid reflux can also cause the pharyngitis. These are the possible factors which can lead to the pharyngitis, right? And what are the sign symptoms? Sign symptoms we have already talked about, but let me mention again: sore throat, fever, headache, okay, pain, swallowing, okay, and lymph nodes, swollen lymph nodes, right? These are the symptoms and specific signs on examination which we can see. When we will examine the pharynx, we will see the specific signs which will relate to the pharyngitis. Those are erythema of pharynx, okay, tonsillar hypertrophy. These can relate to the pharyngitis, okay. Tonsillar exudate also will be there. So what do we have? We had a patient, right, with a complaint of sore throat, fever for the past 2 days. उसको निगलते वक्त दिक्कत हो रही थी, स्वेलिंग में प्रॉब्लम थी, वॉइस में चेंज नहीं था, ड्रूलिंग नहीं थी, नेक स्टिफनेस नहीं थी. अब वॉइस में चेंज नहीं थी, ड्रूलिंग नहीं थी, नेक स्टिफनेस नहीं थी, यहाँ से हमारा क्या रूल आउट हो रहा है? यहाँ से वी कैन क्लियरली रूल आउट द एपिग्लॉटिस, राइट? ड्रूलिंग. If our patient is a child, there will be the drooling, neck stiffness, and a certain posture. Okay, the child will lean forward with the neck straight, neck stiffness, and there will be the change in voice, stridor, drooling will be there, right? So these symptoms, if present, will relate with the epiglottis, right? And he had no history of cough, rash, nausea, vomiting, diarrhea. Okay, so then we made the diagnosis of streptococcus group A bacterial pharyngitis, right? We also had a look on the viral causes of the pharyngitis. Now, signs and symptoms. Bacterial versus viral symptoms. Viral symptoms will include the respiratory symptoms. For example, cough will be there. Just a minute. Cough will be there. Shortness of breath will be there. Or runny nose will be there. Conjunctivitis will be there. Runny nose, conjunctivitis, cough. These are the specific symptoms which can relate, which relates to the viral etiology. Okay. So now we will study about the complication. Complication can be suppurative or non-suppurative. Okay. Suppurative में क्या होगा कि there will be this thick mucus discharge, uh, kind of abscess, right? So peritonsillar abscess is a possible complication of the pharyngitis. Retropharyngeal abscess, otitis media, राइट. इट्स लाइक फेरेंजाइटिस हो गया है, अब आसपास की जितनी भी चीजें हैं उनमें अटैक होएगा. सो पेरिटोन्सिलर एब्सिस कैन बी देयर, रेट्रोफेरेंजियल एब्सिस कैन बी देयर. रेट्रोफेरेंजियल एब्सिस इज mostly in adults after any trauma. Usually it is rare, we cannot see it. And otitis media. And what are non-suppurative? Non-suppurative are like acute rheumatic fever. Acute rheumatic fever can also occur, or usually also occur after the bacterial infection, post streptococcal infection. It is also the post streptococcal infection. Similarly, there is PSGN. PSGN is post streptococcal glomerulonephritis, right? So PSGN, post streptococcal glomerulonephritis, it is very important to note that any sore throat, पेशेंट कैसे आएगा कि सोर थ्रोट ही है, मुझे तो सिर्फ सोर थ्रोट था, राइट, बट विच दैट सोर थ्रोट कैन ऑल्सो लीड टू द glomerulonephritis. If it is caused by the sore throat, it will usually develop after 1 to 2 weeks, right? And if any infection, if any skin infection led to this post streptococcal glomerulonephritis, then it will take around 2 to 4 weeks. Post skin infections, ठीक है. सो पोस्ट स्ट्रेप्टोकोकल ग्लोमेरुलोनेफ्राइटिस, इट्स अ नेफ्राइटिस. तो नेफ्राइटिस में क्या होगा, आरबीसी कास्ट होंगे, हेमेच्यूरिया होएगा, कोला कलर यूरिन होएगा, हाइपरटेंशन के साथ होगा. दीज आर वेरी स्पेसिफिक सिम्टम्स टू द नेफ्राइटिस. सो we will not go into the details of the nephritis here, but just to recall and remember, these are the very specific symptoms about nephritis. And what will be the differential diagnosis? Differential diagnosis, if we talk about the viral etiology, there are, it is often associated with what? Cough, conjunctivitis, and runny nose. ठीक है. Infectious mononucleosis is also the very important factor which we need to rule about. We need to rule out when we talk about the infectious mononucleosis. इन्फेक्शियस मोनोन्यूक्लियोसिस को हमें रूल आउट करना है जब हम फेरेंजाइटिस के बारे में बात करते हैं, लेकिन इन्फेक्शियस न्यूक्लियोसिस मोनोन्यूक्लियोसिस इट कम्स विद वेरी स्पेसिफिक सिम्टम. फॉर एग्जांपल सिवियर सोर थ्रोट, and there will also be splenomegaly, hepatomegaly, abdominal pain. ओके. सो हमने सोर थ्रोट से शुरू किया था, गला खराब था हमारा, अब हमने नेफ्राइटिस को भी इंक्लूड किया है इसमें, इन्फेक्शियस मोनोन्यूक्लियोसिस में भी, जिसमें स्प्लेनोमेगली भी हो सकता है, हेपेटोमेगली भी होता है, एब्डोमिनल पेन है, एंड वी ऑल्सो रूल्ड आउट रिमेटिक फीवर. ओके. सो जस्ट अ सिंपल सोर थ्रोट कैन लीड टू मेनी कॉम्प्लिकेशंस. सो यहाँ पे अगर डिफरेंशियल डायग्नोसिस में हम बात करें तो इन्फेक्शियस मोनोन्यूक्लियोसिस को हमें रूल आउट करना है, विच विल बी विद वेरी स्पेसिफिक सिम्टम्स, एंड द tonsillar enlargement will also be there. ठीक है. The next is diphtheria. Diphtheria, I think most of you already know that it comes with the grayish pseudomembrane, which is very specific to the diphtheria, right? And herpangina. Herpangina is basically small vesicular lesion, small vesicular lesions on the soft palate. ऑल ऑफ दीज कंडीशंस, ये सारी कंडीशंस हमें फेरेंजाइटिस के सिम्टम दे सकती है, लेकिन वी हैव टू वेरी केयरफुली रूल आउट ऑल ऑफ दीज कंडीशंस with the very specific signs and symptoms related to them. Okay, so now how we will make the diagnosis? For diagnosis there is a specific criteria which is called Centor criteria. सेंटर क्राइटेरिया में हम सारे सिम्टम्स को लेकर सबसे पहले इन्हें पॉइंट देंगे, 1 पॉइंट 1 पॉइंट 1 पॉइंट 1 पॉइंट फॉर एवरी स्कोर, फॉर एवरीथिंग. ओके, सो व्हाट इट इज? प्रेजेंस ऑफ टॉन्सिलर एक्सुडेट, 1 पॉइंट. प्रेजेंस ऑफ टॉन्सिलर एक्सुडेट. टॉन्सिलर एक्सुडेट का क्या मतलब है कि अगर टॉन्सिल इरिटेट हो रहे हैं, टॉन्सिल्स का इन्फ्लामेशन हो रहा है, तो दे विल रिलीज अ स्पेसिफिक एक्सुडेट, दे विल रिलीज सम काइंड ऑफ फ्लूइड which is usually we are calling it exudate here. So that will be very specific. Okay, so presence of tonsillar exudates will give this 1 point. Tender anterior cervical adenopathy, जैसे हमने बात की कि lymph nodes will be swollen, then there will be 1 point to this also. Fever was there, right? हमारे केस में फीवर था, lymph adenopathy थी, tonsillar exudate थे, absence of कफ भी था. अब कफ हमने एब्सेंट बोला, राइट, कि एब्सेंट है कफ. इन द एंड आई विल टेल यू वेरी इंपॉर्टेंट पॉइंट्स जो कि कफ से रिलेटेड होंगे, कुछ पॉइंट इससे हटकर, which will tell you the character of the cuff and the possible diagnosis of the pathology related to it. Okay, next is age less than 15 year, add 1 point to the total score. ठीक है, बच्चों में, चिल्ड्रन में यूजुअली इट्स वेरी कॉमन ड्यू टू द many factor viral organisms also. Age more than 45, subtract 1 point from the total score. Okay, सो 15 साल से छोटे बच्चे के लिए हम 1 पॉइंट देंगे और 45 साल से बड़े आदमी के लिए हम 1 पॉइंट कम करेंगे यहाँ पे. दिस इज सेंटोर क्राइटेरिया फॉर फेरेंजाइटिस, टू डायग्नोज फेरेंजाइटिस. बैक्टीरियल फेरेंजाइटिस एक्चुअली, let me correct it, not pharyngitis, bacterial pharyngitis. We are talking about bacterial pharyngitis here. ठीक है, तो for example, out of these points, if you have 4 total points positive, so we'll treat the patient with the antibiotics with we will treat the patient with antibiotics and no further testing is required. If we have 2 to 3 points, 2 से 3 पॉइंट अगर हमारे पास आते हैं, तो there is something called RAT is rapid antigen testing. We usually have this testing available for the streptococcus. Okay, so if this is positive, if the RAT is positive, then we'll treat with the antibiotic. If this is negative, then we'll go with the throat culture. Throat culture is actually the gold standard of the diagnosis, but it usually takes more time, much time needed for the throat culture, for the culture report to come. So um, we can also go with the RAT. If RAT is positive, we can start with the antibiotics. If 0 to 1 points are there, if no point there is only 1 point is there, so no further test and no antibiotics are needed. It would resolve on its own. Okay. So RAT, we have talked about RAT, we have talked about throat culture, and CBC. CBC is also very important to see the neutrophils or the WBC or the rest of other blood markers. And then we come to the treatment. Treatment of this bacterial, it's bacteria, so definitely we will go with the antibiotics, right, if it is positive. And the antibiotic of choice is amoxicillin. We can also use other antibiotics if the patient is for example allergic to the amoxicillin. We can also use the azithromycin, clindamycin in case of allergy. ठीक है, and how do we prevent this scenario? We prevent this scenario by maintaining hygiene. It's very common, obvious, right? Maintaining hygiene, maintain distance, and timely treatment. Yes, this is very important. This thing to mention here is very important. Timely treatment to avoid complications like PSGN. अगर हम टाइम से ट्रीटमेंट नहीं करेंगे, 1 2 3 4 हफ्ते का गैप दे देंगे उसके बीच में, then it can lead to the complications like PSGN, वो streptococcal glomerulonephritis or the rheumatic fever. ठीक है, so this was the pharyngitis. Pharyngitis, we had bacterial etiology, viral etiology, other causes, and we also talked about the differential diagnosis also. And then we have talked about what the possible complications, right? Possible complications were PSG and acute rheumatic fever. Yes, this thing we are left with here. This was life-threatening condition related to the pharyngitis. इन द बिगिनिंग मैंने बोला था कि सबसे पहले हमें लाइफ थ्रेटनिंग कंडीशंस को रूल आउट करना है. तो क्या है वो लाइफ थ्रेटनिंग कंडीशंस? दिस इज एपिग्लोटिस. इफ आवर पेशेंट इज अ चाइल्ड, देन वी डेफिनेटली नीड टू सी द एपिग्लोटिस हेयर. ड्रूलिंग के बारे में हमने बात की थी और क्वेश्चन में भी दिया गया था कि ड्रूलिंग एब्सेंट है, राइट? स्ट्राइडर एब्सेंट है. तो सडन ऑनसेट ऑफ फीवर, एपिग्लोटिस में क्या होगा? सडन ऑनसेट ऑफ फीवर, ड्रूलिंग, टैकीपनिया, टॉक्सिक अपीयरेंस, स्ट्राइडर. ओके, वॉइस चेंज होएगा, ड्रूलिंग होएगा, एंड सर्टेन एक पोस्चर होगा बच्चे का, ठीक है, जिसमें कि उसकी नेक स्टिफ होएगी, वॉइस चेंजेस होंगे. एंड डायग्नोसिस, lateral cervical radiograph, thumb printing sign. Thumb printing sign is very important here, right? You can take the screenshot of this table also. And then there is retropharyngeal abscess, Ludwig angina, peritonsillar abscess. All of these conditions are life-threatening conditions which are related with the pharyngitis, and we definitely need to see for the symptoms, specific symptoms of these conditions to rule out, right? Then the bonus stain. I've talked about the bonus tip, right? About the cuff. कफ हमारे केस में नहीं था प्रेजेंट, लेकिन for example, the character of the cuff is brassy. Then what it is? Tracheitis, bronchitis. It can be extrinsic pressure on the trachea. For example, any tumor. If it is barking cuff, then it relates with the laryngeal disorders. Okay. If it's croupy with stridor, laryngeal disorders are there. Most likely laryngeal disorder, laryngitis, croup. And if it is hollow, bovine, no power, like very dull, then it's vocal cord paralysis. See, it's just cough, and but it has many different characters, right? It can be brassy, barking, croupy, hollow, and then weak cough. It indicates bronchial carcinoma. If it's very weak, जैसे जान ही नहीं है cough में, right? I mean, it's not funny, but see, weak cough. It indicates with the bronchial carcinoma. Paroxysmal with whoops. Then it is whooping cough. Painful. Tracheitis, left ventricular failure. If it's painful, then tracheitis and left ventricular failure. Dry and chronic, then it's GERD, drugs, etc. Okay, if it's dry and it's chronic, then it's definitely due to the GERD. So these, all of these things, these symptoms, these specific findings can also help you with the many things to make your differential diagnosis. So I hope I have made this thing simple for you. We have talked about pharyngitis here. We have talked about its diagnosis, bacterial causes, viral causes, complications also, and then the treatment, which was with antibiotics, right? If it's viral etiology, if the pharyngitis is viral, then we'll definitely go with the over-the-counter medicine like paracetamol. And the most of the viral etiology takes its own time and completes its cycle, and it go away on its own. Okay. So I think this will be it for today. Thank you so much for the lecture.